Susan.
All right, thank you very much. Thank you, Brett, and thank you everybody for having us. We certainly appreciate that. So our president, first of all, my name is Susan Velde, and I am a registered nurse. I've worked at Eisenhower for over 19 years, and most of that in the emergency department. My partner tonight is Karen.
Hi, I'm Karen Ziegler. My background was 28 years in the emergency room, and I've spent the last 8 years in the urgent care at Rancho Mirage Urgent Care.
All right, tonight we're going to be talking about emergency versus urgency, understanding your care options during COVID-19. All right, again, thank you for being here, and if you have any questions, please let us know. Karen?
Okay, at Eisenhower Health, our attention and commitment to high quality patient care and satisfaction to ensure that all patients with urgent medical needs, they get the medical care that they need 24/7, 7 days a week. When a medical problem arises, it requires immediate attention. It's often difficult to interpret, do you need the emergency room or do you need the urgent care? So you can take a minute, decide, and then go from there in a timely manner, which you feel is more appropriate. Okay, is this an urgency or an emergency? What is the difference? Okay, urgent care does provide medical treatment for minor injuries and illnesses. It does need, they do need attention, but it doesn't have to be immediate, within like a 24-hour period. This is commonly used for people that are vacationing here, don't have a doctor here, or locals that live here, and they can't get in to see their primary care doctor. So those are examples of when you'd come to the urgent care. Please keep in mind, though, the urgent care is not your primary care provider. We just treat and then go accordingly. We don't follow our patients.
Okay, and generally, an emergency is a condition that can endanger an individual's life or limb or may cause permanent damage.
Okay, what is an urgent care center? It is a walk-in facility. We give you immediate attention, and it cannot be life-threatening, loss of a limb or permanent disability. Those are a higher level of care. And so, again, if you're visiting out of town, you can't get in to see your primary care provider, this would be a good time to come see us in the urgent care. All right, when should I go to the urgent care? Basically, it is as shown in the slide. There's coughs, colds, sore throats, falls, mechanical falls where there's an object that caused you to fall initially. Anybody that's on blood thinners and hits their head and loses consciousness, that is not an urgent care patient by any means. Simple fractures, no open fractures, no compound fractures, just, you know, simple, my child fell off a skateboard. Minor lacerations, just that. We have done some pretty extensive repairs on lacerations. However, if it's an extreme laceration and you're bleeding arterially and it spurts up, probably need to go to the emergency room. We see a lot of insect bites, skin infection, rashes, cellulitis, minor burns, any type of eye irritation, foreign body in the eye, a lot of urinary tract infections. We do school physicals and routine vaccinations. the test that we can do on site is a UA, a rapid strep screening, a rapid flu, glucose monitoring, pregnancy testing, and a rapid hemoglobin, along with a rapid HIV test. Those are all done on the site. We also, at all 3 of our facilities, have radiology services, at least X-ray. Okay, when testing is done on site, what we can do is, if it's not a critical situation, we can collect the blood in the urgent care and then send it off to Eisenhower lab, where they will process it. And usually the turnaround time is 24 to 48 hours, unless it's a send out lab, which typically will go to the Mayo Clinic, and that can be a turnaround time of a week. Go ahead. Oh, okay. What's nice about our facility is that it's integrated throughout. So, for instance, I have a patient that comes into the urgent care and he's been seen in the emergency room. I can quickly go into that patient's chart and look for lab results, radiology reports, and just their medical records, so I have a better understanding of what's going on. Okay, our clinic staffing consists of physicians, physician assistants, and family nurse practitioners. All of our staff, the 3 that I just mentioned, have extensive either emergency medicine or family practice. We also work closely with the primary care physicians, especially if there's a change in treatment, to aid in mainstreaming follow-up care. Occasionally, what we have to do is we have to do a referral to a specialist. So, you know, podiatrist, a foot doctor, which we can't take care of in the urgent care. That's when we refer them to a specialist. Okay, our nursing staff consists of each urgent care has 2 RNs. Primarily, everybody's background is emergency medicine. We have LVNs and we have MAs, which is medical assistants, and LVNs are licensed vocational nurses. I want it to be noted that our MAs are all phlebotomy certified. So it's nice they can draw the blood and help everybody to, you know, mainstream the process of taking care of the patient.
Talk about the physicians. Yes. All right. Okay, so when should you go to the emergency room? All right, so call 911 or go to the nearest emergency department for any life-threatening conditions, such as chest pain or discomfort. We're going to talk about this a little bit more, but if you think you're having a heart attack, 911. If you're having trouble breathing, palpitations or irregular heartbeats, stroke-like symptoms, and that includes sudden onset of numbness or weakness of the arm or leg, confusion, trouble speaking or understanding someone, sudden dizziness or loss of balance, or loss of vision. Loss of consciousness or any type of seizures. If you pass out for no reason, you need to come see us. Severe abdominal pain. Fever in babies about 6 months or younger. All right, poisoning or overdose. Heavy or uncontrolled bleeding. Any head injuries. Karen mentioned if you are on blood thinners, you fall down and hit your head, we want to see you in the ER. And of course, major burns. All right, time is muscle. When you are having chest pain, you need to call 911. Unfortunately, in my career in the emergency room, We have many people who don't want to make a big deal of it, and they're not quite sure what's going on. Unfortunately, the longer you wait, the more damage is done to your heart. So if you're having chest pain, it's a 911 call. We want you to come in, we want you to be monitored, and we want you to be safe. The sooner you come in, the sooner we can intervene, and the less damage is done to your heart. Very important. All right, time is also brain. So we talked briefly about stroke symptoms, but here's a little mnemonic: be fast. You've probably seen these driving on the road at the bus stops. They're all over. So if you have a sudden loss of balance, that is a warning sign you need to come in. Eyes, have you lost vision in one eye, or did you lose vision and did it come back? We need to see you right away. Face, does their face look even? If you smile, is the smile even? Is one arm or leg weak or numb? Is the person's speech slurred? Do they have trouble speaking? Can you not understand them? And time is of the essence. Time is brain. If you have any of these symptoms, we want to see you right away. 911, when you come in, we have a very special area in the emergency room for you. The minute you're brought back with stroke-like symptoms, you will instantly have 8 people around you asking you questions. We'll get a CAT scan of your head right away. The sooner you come in, the sooner we can do something about it. So when you get to the emergency room, a nurse is going to assess you right away, and this is called triage. So if you can wait, the nurse will already start blood work, x-rays, whatever you may need. If this is something life-threatening, you will be brought back immediately and have the doctor, whatever intervention needs to be done. If you're having chest pain, again, I want you to call 911. It is very important. The paramedics can monitor you until you get to the emergency room, and we know you're going to be okay. When you arrive, you're going to get an EKG. The doctor's going to see you. We'll get lab work. You're going to spend several hours getting everything assessed, and then you and the doctor will decide, are you going to stay? Do we need to do a stress test? What do we need to do next? If you are having stroke-like symptoms, you will be sent back to, taken back immediately to a special area where many, many things are going to happen at once. The doctor's going to be there. All kinds of things are going to happen because, again, time is of the essence. Timing is everything. All right, things that you can help with your visit, whether you go to the emergency room or to the urgent care. Bring a list of the current medicines that you're taking. This even includes vitamins or any supplements. Things can interact, and it's very important for the staff to know what you're taking. We want to know, when did the symptoms start, or when did the injury happen, and how the injury happened. We want to know any underlying health conditions you may have. Do you have a history of heart trouble? Do you have a history of arthritis? All of those things can be very important and be very helpful to the doctor. And of course, any allergies to medication or foods that you have, those things are very important. Again, you can make a medication list. You can write all these things down and just hand that paper over. This kind of information is very important for everybody to take care of you the best they can.
And I would like to just add that these are universal questions, regardless of where you are or if 911 picks you up. These are standard questions. So if you can keep a list of your medications, if there's somebody with you that can tell us a little more information about the symptoms or the injury that took place and what their health conditions are, and of course, allergies to medication and food, very, very helpful.
Okay, in times of COVID-19, as we can all attest, things have definitely changed, okay? Again, the way we do things may be a little bit different, but your health always remains our top priority. We are here for you. So at this time, when you go to the urgent care, when you come to the hospital, except in very special circumstances, no visitors are allowed.
Correct.
Okay, so that's always kind of anxiety producing when you drop your loved one off at the urgent care or at the emergency room. Again, we will keep contact with you and keep you apprised of what's going on. But some people tend to get a little frustrated with that, and it is scary. And this is for the safety and health of everybody. We don't want you exposed unnecessarily to anything and the other way around. So if you're having a cough, shortness of breath, fever, symptoms of COVID, once you arrive to the clinic or the emergency room, you will be taken to a special area. And again, we're just making sure that it protects everybody, including yourself. All right. When patients are inpatient in the hospital, again, this is a scary time for everybody. Families worry at home. Patients are worried because they're by themselves, but we've done everything we can. We've got FaceTime, we've got iPads. We'll help you with whatever we can to make your visit with us as pleasant as we can, because we do understand. All right, so we want to thank you for joining us this evening to learn about urgency versus emergency. If you have any questions, please let us know, or you can always call the urgent care center or the emergency department, because we are here for you.
Great, thank you, Susan and Karen. We'll open this up if there's anybody who has a question in regards to some of these things we just talked about. Feel free to ask or put a note in the chat. Not necessarily seeing anything. You answered most of my questions. I know one of the things being next to the emergency department here and then traveling to the clinics often to see the urgent care, there's always people in the parking lot that are always kind of say, where do I go? What do I do? And that is truly the most distressing thing for many people, is having to maneuver to get somebody that they're with into the care stream. And thankfully the staff is very well groomed with that to be able to acknowledge that and work with them. So I applaud you all for that kind of compassion and empathy.
Well, we know how hard it is. And there's one thing that I cannot stress enough, and I know Karen feels the same way, is that both facilities are open. But one trend, which I feel is kind of a dangerous trend, is people are staying home sick too long. The volumes in the emergency room are just down a little bit, but the patients are coming in much sicker. And we don't want you to wait. We are doing everything we can to keep all of us safe. And again, we're here and we're open for you.
I do have a question. And I think I heard you say, so if you have a fall or an injury and you are bleeding and you are on blood thinners, that's an emergency room situation? I did not know that.
98% of the time it is, especially if their head is involved and if they've lost consciousness. That is definitely for the emergency room. However, if they seem stable, there was no loss of consciousness, questionable, did they actually hit their head? Did we see a bump on their head? We can go ahead and treat them and send them to Lucy Kersey for a head CT. But that's only if they're stable. But we typically do that a lot. We see abdominal pains. We can only do so much. We draw their labs, and then we send them over for ultrasound at Lucy Kersey.
Great, we do have another question. How long is the average visit to the urgent care?
I wish I could give you a straightforward answer to that. It just depends on their signs and symptoms. Obviously, let me explain that if somebody comes through our door in our waiting room, they are now our responsibility. So This has happened in the past. We have gotten stroke patients. We've had heart attacks come in. Obviously, they're going to take the priority. So everything else kind of is on the back burner until we can expedite, get 911 in, and send them to the emergency room. And that does happen on, not a frequent, but it happens quite a bit. Some people think that the urgent care is the emergency room. Some people with this COVID will say, I don't want to go to the emergency room because they have COVID there. Well, guess what? COVID's everywhere. So typically suture, I've got a urinary tract infection. Those are like 30-minute turnaround times.
Great, thank you. Another question in regards to emergency. So in a situation where somebody comes into urgent care and at some point it's assessed that they would need to go to emergency department. And then there's a criteria of, is that if they say, well, I really want to go to Eisenhower. I'm in Palm Springs and I'm at Sunrise Urgent Care, but it's like, I really want to go to Eisenhower, but you're, literally a mile away from Desert Regional. What is the criteria by which you ascertain, I guess, where that person should go?
Okay. The criteria is going to be their acuity, their level of sickness. If they're having a heart attack, they're having a stroke, you want to go to the closest facility. Once they're stable or become stable, then they can transfer to their hospital of choice. But right now, their patient and the care that they receive, time is of the essence. So they will go to the closest facility.
Great, thank you. Do we have other questions from anyone?
I just had a question. I hear from seniors periodically that the easiest way to get into the emergency room if you don't want to wait a long time is to call 911 because they'll just take you right in. Is that a dangerous practice for people to start assuming? Because you get somebody who really is having a heart attack and now you've got all these other people kind of clogging up the back doors, if you will. And so can you speak to that a little bit?
Thank you. And actually, that's another very important point. Sadly, in the many years I've been in the emergency room, that has happened often. What we do is we have, it's a special position called an MICN, a mobile intensive care nurse. When a patient is brought in by ambulance, not only do the paramedics call ahead of time saying I'm coming in, but so the MICN will get a little bit of a report, but they will also check in with the MICN. And if the assessment is such that they do not need to tie up an acute care bed, they will be sent out to the lobby to wait their turn, because that is a very dangerous practice. The emergency room is just that. It is for emergencies. And, if you just think of what if one of your loved ones is having a heart attack or a stroke, but yet I had somebody laying in a bed that just didn't want to wait. It's kind of frustrating. So we try to take the sickest patients back first. If that makes sense.
Great, thank you for that explanation. Any last questions? Candace or anyone else on the line?
I think I'm good. I always have a question about blood thinners because I'm on them. And I just had a CAT scan and I forgot to tell them that. And then they're like, why are you bleeding like this as the blood's dripping on the floor? So I do have to remember to always let folks know when I'm having any kind of procedure that I'm on blood thinners, even just a needle being stuck in my arm.
Exactly.
Right.
Yeah. And I'm guessing that the issue there is bleeding out really quickly.
Exactly right.
Yes.
Exactly right. That's why we don't want to take any chances. And I'll tell you, no one will ever say that you shouldn't have come to the ER or you shouldn't have come to the urgent care. No one will ever say that. It is so much better to err on the side of caution. I would much rather say, oh, you just have a sore throat or a bump on the head, and then let you go home, as opposed to something untoward happening, always.
So oftentimes when a primary care physician is unable to see a patient, oftentimes during season, it gets so crowded, you need to see your doctor and you just can't get an appointment for 2 weeks, and you go to urgent care as a follow-up, then does urgent care make sure that your primary care doctor has all that information so that continuity of care then continues when they do get into their doctor?
Oops, I'm sorry. Are you finished?
Yes.
Oh, okay. My understanding is all of Eisenhower Health use the same computer system. It's Epic. And so they can readily get into anybody's chart at any time and, you know, read where this patient's been, what they were treated for, what their lab results look like, x-rays, so on and so forth. So it's nice, it's universal. There's people from all over that use Epic, and it's nice. You know, we've never seen them in the urgent care before, but we go into the system and it defaults or populates like all their medications and their medical history. So, you know, we have a pretty good idea, and it's another form of mainstreaming. You know, sometimes the patients can't remember, oh, I take this blue pill, and I don't know, they don't even know what it's for. But we can, by going through their chart and seeing other facilities' notes, we can pretty much determine what's going on, or at least what their past consists of.
And then do they just let their doctor know that they've been to urgent care if there's,
No,
in case
we
there's
don't
follow-up?
call the primary care doctors. No.
So the patient needs to let their doctor know that they've been to urgent care and were
Correct.
sent for
And
an x-ray or
technically,
sent for whatever.
yeah, technically, there's normally a follow-up, and they're going to follow up with their primary care doctor, at which time, when they make the appointment, they can say, I was seen in the urgent care, and they'll kind of flag the physician like, oh, okay, what's going on here?
Okay, great. Thank you.
You're welcome.
All right. With that, I think we're no more questions that I see from anyone. Any final comments from our presenters?
Again, we are here, whether it's the urgent care, whether it's the emergency room, we are here for you, and we want everybody safe.
We solely want the best for all of you.
Well, thank you very much, and thank you for being with us tonight, and in presenting together. That's really nice as well. Nice change.
Thank you so much.
Yes,
Thank
thank
you
you
all.
for making it possible.
All right.